Victory Studios in downtown Little Rock, this is Capitol View.
And good Sunday morning to you. Welcome into Capitol View. I'm Jay Bir. The rural parts of the state have completely different dynamics and even their own sets of issues when it comes to health care. And here to help make a little bit of sense of the state of rural health care here in Arkansas, Dr. Joe Thompson with ACHI and Marquez with the Arkansas Municipal League. Gentlemen, we certainly appreciate you coming in here. Let's just get to it here. You know, the pandemic, it seemed to expose a lot of the system, and especially there in the rural parts of the state.
Well, a year and a half ago, Arkansas, as well as the rest of the nation, was chugging along, and then suddenly we had this new threat. And it was a new health threat for community leaders, for healthcare leaders, and it really did stretch the rural parts of our state in a way that I'm very proud of their response.
Yeah.
But it does show the fragility with which we have. Luckily for our state, you know, almost 10 years ago, we expanded Medicaid so that they were in a little bit better fiscal health than some of those around us. But this virus was a major challenge and a threat to those communities.
And I mean, from a municipal standpoint, I mean, there's a lot more rural in this state than there is urban.
Right. There are 500 cities and towns in Arkansas, and the largest percentage of them are below 2,500. And so the result was, when the pandemic hit, there were all these questions, and there was really no coordinated effort. So between the two organizations, we made I think a really good decision to get science, factual, and logical information out to the membership. And we did these phone calls. Really, we did them every week for a long time. And we had very active participation, great Q&A, but we talked about, all right, we got all these emergency personnel people. What do we need to do? We need to get them PPE. What about our city council meetings? Let's do them virtually, or let's get plexiglass shields up, et cetera, et cetera. So the combination of the two organizations made an enormous difference in city government and in those communities. Made them healthy and still got the services done.
Right.
City Hall doesn't shut down. You got to have cops, you got to have firefighters.
Exactly.
You got to have a road paved, water. I mean, it doesn't shut down. So
you got to have some news folks here as well.
Right.
And you mentioned something. It's that coordination. It seems to me like the one big thing that comes out of this pandemic is the ability to coordinate and all the different entities that realize, hey, we can actually work together and it's a lot more efficient and things get done.
Oh, that's exactly right. One of the greatest things is this relationship between the organizations. Joe and I have become friends now, and his crew is wonderful, but we would not have been able to do what we did without their assistance.
Well, and Jay, the governor and then Secretary Smith, now Secretary Romero, were working at the state level and moving things and everything.
Exactly.
But your local leadership needed information, needed to understand. Our center offered some surge capacity to be able to put local data out for school districts or municipalities. And on the phone calls that we had weekly, there were some really good questions and there were some really interesting questions.
Yeah, right.
I can imagine it was the same way, being in those COVID meetings on the daily there with the governor. Some interesting questions thrown out there from time to time. And I guess, too, you know, how do we compare things now from a rural standpoint and the urban standpoint? Because again, it's such a different dynamic with both of those, and access being one of the chief things.
Well, I think one of the things that we learned is the rural emergency and non-emergency transportation. You know, we had people getting sick from COVID, showing up in a rural hospital and then becoming sicker, and we needed to move them. And so really thinking in the future about how we strengthen our movement of people to get them to the best care at the best time for their services. We saw an explosion of telemedicine. As doctors' offices shut down, we shifted. I mean, we accelerated telemedicine by a decade. And at one point, almost all the services were being done on your cell phone now. And I really doubt that patients are going to wait 2 hours anymore in a doctor's waiting room to see when they were able to do it on their cell phone or via an iPad or another electronic means.
And even from the the medical sense, I mean, every entity is competitive in and of itself, despite the fact that they all kind of do the same thing. But that all seemed to kind of go out the window there for a while. There was and it kind of goes back to the cooperation where it was all there. I mean, it kind of didn't matter. It was all hands on deck. I mean, is there a sort of a model for that going forward? Not necessarily to address maybe the next pandemic, but just even in general, if resources are scarce here, oh, hey, we've got some. We've got you on that.
Well, I know Mark will attest to this also. The connectivity of individuals and institutions is stronger now. We did come close to overtopping our healthcare capacity and have to open field hospitals and things like that, earlier this year. Luckily, with people's actions and now with the vaccine, we're able to relax a little bit. We're not through. The risk is still out there, but I think we're in a much better place than we were 6 months ago.
And it offered a level of consistency that we've never had before. So when cities and towns were calling in, they were getting the same information, they were given the same websites, same places to go look for things, and in many instances, some of the same policies. We wrote out a lot of white papers for cities and towns, and and with Joe and his team's help, we were able to make sure that everything was accurate. And so City A and City B were doing virtually the same thing.
And I would get on the phone and talk to local CEOs, local hospital folks to say, okay, what are you seeing on the ground right now? Because, what was happening in New York City was not what was happening in rural Arkansas. I think the one thing we learned, at least with this pandemic, is it's not like a light switch going on. We had a inner city, threat, and then it went to larger cities, and then it started out in the rural parts of America. And so, we need to step back now and learn, okay, what can we learn from this? Because the threat is likely to come back in some different form in the future, and we'll need to have some of the same success that we had this time.
Oh, I like it here. He has the setup here. We're going to keep these guys around here. We're going to have another block here with them, and that's what we're going to do. What have we learned? So that is coming up here in just a minute. Stick around. We'll have more Capitol View coming up for you.
Buy more, save more at the massive 4-day sale at Furniture Row. That's 4 days to save $100 on every $1,000 you spend, plus 7 years, no interest, and free shipping. But don't wait. The massive 4-day sale at Furniture Row ends Monday.
Come and enjoy a new experience in shopping for your home. At Aladdin Rugs and Home Decor, we have over 5,000 rugs in the latest colors and styles. Bring your pillows, your pillow shams, and sizes. We will help you select the perfect rug. We're #1 in customer service with 15,000 square feet of rugs, unique home decor, wallpaper, and flooring. Remember, buy today, take it home today, and save. Why wait?
Here at Burroughs and Mr. Frank's Optical, we're happy to be a family-owned and operated business.
When you come through that door, you become part of our family. We make sure that the frame fits properly, that it looks good on you, the color's right. We want you to look your best.
We do custom lenses here, any shape that you want. We just don't offer anything but the very best here.
That's what you're going to get, is jewelry for your eyes.
Summer's here, and with a great deal on a new Toyota, you can go out and enjoy all your favorite summer sports, like softball, beach volleyball, triathlons, racing, golf. Whoa! Someone needs lessons.
During the Summer Starts Here sales event, get $750 customer cash. Or qualified lessees can lease a new 2021 Highlander L for only $309 a month.
Get your Toyota today.
Toyota, let's go places.
It's the massive 4-day sale at Denver Mattress. Right now, save $100 on every $1,000 you spend. Or check out the Summit Firm for only $199.99, plus 7 years no interest and free shipping. But hurry, the massive 4-day sale at Denver Mattress ends Monday.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back into Capitol View. More with Mark Hayes, Dr. Joe Thompson with ACHI, and we kind of got into it there in the last block here, but now we kind of look forward here. So what's next? You mentioned the explosion of telemedicine, how it's been really just thrust to the forefront of things, and it's now kind of just part of our daily lexicon here. What are we seeing going forward here when it comes to the usage? And then I guess for you, broadband is obviously part of that, but we'll start here with you there.
That's huge.
Yeah. Well, I think we're forced to actually turn to telemedicine and other mechanisms to get people care they needed. People with diabetes, ongoing, mental health issues, other things that we had to use a different venue that had been present but really not anywhere at the scale that we turned to. As we move forward and people are able to go back to clinics or back to hospitals, we need to think about, well, what makes more sense if we can do it telephonically and save people a trip either to Little Rock for specialty care or to their local provider when it can be, and even maybe more effective. Calling you in your home may be better than having you in the doctor's office. But we do have broadband issues. We have areas here in Pulaski County that do not have broadband and could not participate in telemedicine. So I think that's one of the real needs and opportunities.
I agree. The shared resources we learned early on, we had places without PPE, and we wound up having the ability to connect various cities and counties together to share those resources. The same thing's going to happen with broadband. We're going to get money out of the next federal program. We had some law change in the last session that allowed partnerships, private-public partnerships that have never truly existed before, at least not in a meaningful way. And this will give us a chance to actually get that educational material out there and that medicine in people's homes where it's never been done before. So I'm excited about that. I think it's a great chance.
Jay, I think one of the other things that happened in the legislative body, and you in the news covered it, about the Medicaid expansion. It's historically always been a battle. It was not a battle this year, in part because of the health threat from COVID. But in this year's legislation, there are new strengths put in place for rural parts of our state, specifically 3 programs that hopefully the waiver will be approved to support mothers and their infants in rural parts of our state, individuals that are in transition from either corrections or youth service facilities to get back on their feet, and then obviously the members of our rural communities that have mental health issues or substance abuse issues, trying to support those. So those are 3 new programs that will be coming out hopefully with the Medicaid expansion. Could build off the broadband, use the telemedicine. I think we've got some real opportunity here to take the state forward in an exciting way.
And that's the Our Home program that he's referring to there. And I guess, too, from a municipal standpoint, I mean, how does that sort of change the game? Because it's very focused sets of, this is what we need and this is where we need it. And obviously, again, it comes down to rural health care is just sort of its own beast. But especially, too, when it comes to that maternity care, it's kind of been a struggle for years.
It has. I think the thing we get now and that we've learned from the last year and a half is that we can be creative in our thought processes and we can engage with groups we've never engaged with before, including that kind of programming. I'm excited about having some of our smaller communities finally be able to get the sort of health care that they have longed for and the information that they need to stay healthy. And so those programs I'm very excited about sharing between cities and towns in this state.
Jay, one of the other things that came out of the federal legislation is the opportunity for some of our smaller hospitals to have a new designation, a rural emergency hospital designation. Historically, hospitals have been required to have inpatient beds. We have some small hospitals that those inpatient beds just aren't utilized, and they're very costly. We probably have 6 or 8 hospitals that could turn into much more of an outpatient emergency, short-term stay unit to serve those communities better that are smaller, but they want their healthcare system local.
And I guess finally here, we're getting into the American Rescue Plan. What are we looking at? Because I know there's not necessarily as many strings attached as we saw with the CARES Act, but it's one of those things where here you go, you guys figure it out. Here's kind of what you can spend it on, but hey, make it happen.
Yeah, we're actually developing some pretty stringent guidelines about where cities and towns can spend money and where they can't. One of the things that's been a little overlooked is the water and sewer programming. And in rural Arkansas and a lot of our smaller cities, those systems are failing and failing miserably. That ties directly to the ability to have good health in a community.
Bullseye.
And if you can't marry that together, then you have a real problem on your hands. So we're going to push those agendas to our people using the same kind of phone calls and group messaging that we did during the pandemic to say, here's where you can spend it, here's where you can't. give them checklists, go through the Treasury guidelines for them. Those will evolve and they will become more specific over time.
Yeah.
So that continued connectivity between all of us is really important.
And Jay, it wasn't just the municipalities that are getting funds, school districts, county judges, others are getting resources. And we know that there are, acute needs in each of those, but we hope also that those groups can come together to really think about their communities that were hit hardest by COVID, those that have the most challenges with transportation or other areas, so that we could have a health improvement zone approach, and each could do their own part to really lift up the communities across the state, particularly our rural communities that frequently get left behind on some of these programmatic issues.
Go ahead.
Taking some of that's an incredibly important point. We have had a propensity for an entity to spend money on a thing.
Yeah.
Now we have an opportunity for several entities to spend money on a thing and do it better than it's probably ever been done. And that's very exciting.
And which kind of goes back to that whole cooperation thing,
Yes,
mi casa, su casa sort of deal there. Well, we could probably take up 3 shows worth of rural health care, but we're going to have to call it there, and we will definitely have to try to do this again because there's a wealth of information, and it's always an evolving thing. That rural health care, man, it's a living, breathing thing. Mark Hayes with the Municipal League here of Arkansas, Dr. Joe Thompson with ACHI. Gentlemen, we certainly appreciate the time. We'll do it again.
Thank you.
Thank you.
Absolutely. Well, when we come back, we look at the Memorial Day holiday. I got my tie here ready for you guys. You're watching Capitol View on Sunday morning.
Every year, people are killed when they come into contact with power lines. But tragedy is easily avoided. Large equipment, tools, and materials can become electrified and send a deadly current into your body. Make a note of power lines on any job site and exercise extra caution in those areas. Keep your distance. Please report hazards to Entergy. Take a minute. Save your life.
Looking for that small town feel with a big personality? BB has easy access to all of the amenities of the larger cities while maintaining all of the pleasant benefits of a small town. Conveniently located within minutes of the capital city of Little Rock, bustling Conway, and populated Searcy, you'll never find yourself farther than a comfortable drive from any big city interests. Looking for a neighborhood home or a bigger piece of property in the country? BB offers affordable options for both. Easy access to the interstate makes BB the perfect location to start a business or relocate if that's your need. Call the BB Chamber. Let us help. When it comes to education, BB is home to one of the best public school districts in the state and the top-rated community college, Arkansas State University, BB. What are you waiting for? Give us a call or look us up online.
I'm Mayor Robertson and invite you to live, work, shop, and play in BB.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to Capitol View. Memorial Day is tomorrow, and we do appreciate those who gave all here. And here to kind of get us updated on all things veteran affairs is our veteran affairs strategist, Nicole Hart. How are you, girl?
I'm good. How are you, Jay?
I'm doing wonderful. We finally got you in here, and it's all good. Again, Memorial Day tomorrow, you know, kind of doing some of the work that you do. I guess I reflect on that a little bit. What does it mean to you?
Well, you know, so I've been a veteran advocate in the state for the last 15 years, and For me, in Iraq, I lost some really good friends, people who were close, personal to me. Some of them, I even held their hand as they breathed their last breath. And so it's always been a personal thing for me to make sure that people, not only we fought so that people could celebrate Memorial Day however they want, but just taking a moment to remember those that died and fought for the freedoms that we enjoy. It's something special that touches my heart. And it makes me remember my commander, our section sergeant, the people who I knew that died in Iraq, and all the people that died in service to their country. So. Now
you're advocating for everybody to take a minute. You kind of mentioned it there, but specifically to take a minute, and a very specific minute tomorrow. Kind of what's behind that a little bit?
Well, so you know that there is a national opportunity for people to take a minute at 3 o'clock.
Yeah.
But at noon is when they lower the flag. So what I'm asking people to do is to call a minute in memory. In Arkansas, create this energy about their respect for Memorial Day and sharing with us on Capitol View KARK, telling us why they are pledging to take a minute to remember our fallen and those who have fought for our country and what Memorial Day is really about. And taking that pledge to say that they're going to, in light of everything else that they're doing, take that minute at noon on Memorial Day to just remember those who fought and died.
That's right. So make sure you get the flip on your burgers right before that. That way you can kind of partake in some of this. Yeah. And speaking with folks across the state here, it's such an interesting dynamic with veterans, and I know it's Memorial Day, but you still got to kind of include some of those guys as well here. I mean, for them, this holiday is a lot different than for maybe guys like me.
Yeah, I know for me, I take my kids now. They're old enough, so they're 10 and 5, and I take them to the Veterans Cemetery, and we lay flowers on people's graves. We pay our respect. I tell them the story of these great men and women who died and what it actually means, because the reality is their memory won't continue unless it's through us. And so I think everybody takes part in that, by all of us taking an opportunity to remember all of those. And so everybody can do that. And I think you could go out there, lay flags on people's graves and flowers just to pay your respect, because it really matters to the families and to just to Arkansans who that really matters to them.
Now I've got some notes here, and Memorial Day actually established, it was quite a different vibe when it was first established here. Give us a quick history on just Memorial Day in and of itself.
Well, it was called Decoration Day, and it was, I know that it was started as a way for people to kind of commemorate and go lay flags and flowers, but it also came about as a result of our service members wanting to take time off to go do that and not get their paycheck docked. So there was something particular to that, making sure that there wasn't anything connecting them from keeping their pay, even though they wanted to honor their fellow comrades.
Right.
And so that's how it originally started. And so now over time, there's all of these traditions and things that we do on Memorial Day. We see our president, our governors, all of these elected officials really kind of taking time to honor. I know last year during the pandemic, a lot of things were shifted. So the Memorial Day ceremony, when we go up to the Veterans Cemetery, all of those things change. And it matters. I got to attend over probably 46 funerals of our fallen when I worked in Governor Beebe's administration. And just to see those families and know that their lives are very different every day after, it makes me fight even more every day to make sure that I remember not only their loved ones, but everybody on that field.
And do you always notice that, maybe some of the guys who are veterans, do they kind of feel that respect on this day? Because a lot of times, I think a lot of us kind of get stuck into the, it's an extra day off from work. I benefit from the guys way back when because now it's a bank holiday for me.
But you get to grill those burgers and hang out with family. But I mean, I think that one of the things that I know in the VFW American Legion and the conversations that I've had with veterans throughout the years, I think we recognize that that's what fighting is about, is the freedoms that people have to enjoy however they want. But for us, it's something about when friends and battle buddies who have died in service, you just kind of want everybody to take a moment and remember those people and their sacrifices. And that's kind of the sentiment that I've gotten from other folks is do what you do. You know, if you want to enjoy your family, grill some food, but just remember that this day is about something more than just that. It's more than the sales that you're going to get at the stores.
Yeah.
It's more than the time off from work. But it's about people who actually fought and died.
Absolutely.
And to take a moment to remember them. So I think it's a great idea, something that I'm hoping Arkansas can just take ownership of. And every Memorial Day, we take a minute in memory to remember those who have fought and died.
Remember, do it at noon. Noon is right here. And two, I mean, I guess, you know, does the pomp and circumstance ever, you know, get old? Or is it one of those things where, even for veterans, you know, it's always revered, you know, to see the flags on the headstones and to, you know, all the government officials, you know, go through and, you know, granted, they might say some of the same stuff, but it's still one of these things where it's like, man, that's important, and it's a thing that in this country, you know, those guys are revered, should be revered.
Yeah, and I think, you know, just think about the times that we've gone through, right? We've gone through a lot of divisiveness in our nation. We've gone through race wars and people, you know, just all these things happening. And I think Memorial Day is that time where people get to put all that aside and they remember that it's about the red, white, and the blue, and it's about all the things that we believe about America. And so I think the reverence come in everybody believing in the same thing, and that we believe in our country, and that we're all a part of it. And so this is our moment to put all of that aside, and let's just be thankful for being American.
Let's go. I'm ready to run through a wall after that one. All right. Well, there you go. We try to educate you here a little bit on Capitol View. So we thank Nicole Hart, Veterans Affairs Specialist, for helping us to do that. It is a pleasure. I'm glad that we finally got you in here. Let's do it again.
Yes, bring me back whenever you want.
Absolutely. Oh, absolutely.
And I got to give a shout out to the Army Green. I'm an Army girl, so I had to wear my Army Green today.
We would be remiss if we didn't drop which branch, you know, because I know y'all get competitive out there.
We do. My Air Force, my Marines, all of those, but it's about the Army.
A little extra care for those guys, right? Again, Nicole Hart, Veterans Affairs Specialist. We appreciate it.
Thank you.
And we are back to wrap it up after this. You're watching Capitol View on Sunday morning.
Welcome soon. American Ninja Warrior is back, and we've lowered the competitor's age to 15. These kids make this course look like child's play.
I can't legally drive, but I can legally fly.
Ninja Warrior premieres Monday on NBC.
I would like my children to see that in spite of grief, you have to continue.
Oh, I will.
You little one, you are a superstar.
The lab's in the store. I got my glasses in a few hours. Why doesn't everybody do this?
I walked in and out with my glasses an hour later.
Just say no to waiting days for glasses.
I watched them make my glasses in the store.
I love saving money and time.
At Success Vision, I got great prices and my glasses in the same day. Why doesn't everyone do it that way?
$239 in an hour for less. Come see us today, Success Vision Express.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And that will do it for this week's show. Again, we thank you to all that served, and we certainly appreciate the ones that gave the ultimate sacrifice. We will be back here again next week for an all-new Capitol View. Enjoy your Memorial Day holiday. We'll see you then.